Histrionic Personality Disorder, HPD, represents one of the lesser understood yet significantly impactful psychological conditions in the spectrum of personality disorders. Characterized fundamentally by a pervasive pattern of excessive emotionality and attention-seeking behaviors, HPD manifests as an overwhelming desire to be noticed and appreciated. Those affected experience a profound discomfort when not the center of attention, leading to distinctive behavioral patterns that impact their relationships, work environments, and overall quality of life. According to current diagnostic frameworks, approximately 2 to 3% of the general population meets the criteria for this condition, with a notably higher prevalence among women, though this gender disparity may reflect diagnostic biases rather than true distribution. The emotional landscape of individuals with HPD is particularly distinctive. Their feelings often appear intense yet surprisingly shallow, changing rapidly with little apparent cause. This emotional volatility frequently manifests through dramatic, sometimes theatrical expressions that seem exaggerated to observers. A person with HPD might react to minor disappointments with overwhelming tears or respond to slight compliments with effusive gratitude that seems disproportionate to the situation. This emotional intensity, while genuine in the moment, typically lacks the depth and consistency found in more stable emotional patterns. The individual may describe themselves as feeling things more deeply than others, yet paradoxically struggle to maintain emotional connections over time. Physical appearance and self-presentation take on extraordinary importance for those with HPD. Their style choices often aim to be provocative or dramatic, utilizing bold colors, revealing clothing, or distinctive accessories that ensure they stand out in any setting. This isn't merely about fashion preference, but reflects a deeper psychological need to capture and maintain attention. The individual may spend excessive time perfecting their appearance, experiencing significant distress if unable to present themselves as desired. Importantly, this focus on appearance transcends vanity. It represents a fundamental strategy for securing the attention and validation they desperately seek. When compliments or reactions aren't forthcoming, severe anxiety or depressive symptoms may emerge. The communication style associated with HPD presents another characteristic dimension of the disorder. Speech patterns typically favor impressionistic expressions over concrete details, often featuring colorful but vague descriptions, dramatic pronouncements, and emotional appeals rather than logical arguments. While often charismatic and engaging initially, this communication approach may frustrate others over time as substantive content seems perpetually elusive. The individual might dominate conversations, redirecting topics toward themselves when attention drifts elsewhere. This isn't necessarily conscious manipulation, but rather reflects their profound discomfort when not actively engaged with others. Relationships for individuals with HPD present particular challenges, as they frequently misinterpret the nature and depth of their connections with others. Casual acquaintances might be described as best friends, while professional relationships may be perceived as deeply personal. This tendency to sexualize non-sexual relationships can create confusion and discomfort, particularly in workplace settings. The initial intensity they bring to relationships often makes powerful first impressions, but maintaining connections becomes difficult as the constant need for attention and validation exhausts others. Partners may feel like audience members rather than equal participants in the relationship, leading to eventual disengagement. The developmental origins of HPD likely involve complex interactions between genetic predispositions and environmental influences. Research suggests that temperamental traits such as high emotional reactivity and sociability may have genetic components that create vulnerability to the disorder. Environmental factors, particularly early childhood experiences with inconsistent parental attention or conditional validation, appear equally significant. Children who discover that dramatic or exaggerated behaviors reliably attract attention may develop these as persistent patterns. Some developmental theories suggest that disruptions in early attachment relationships may contribute to the intense fear of abandonment that underlies much of the attention-seeking behavior. Individuals with HPD commonly display a constellation of distinctive traits. They tend to feel uncomfortable or unappreciated when not the focus of attention, often using physical appearance, through provocative dress or exaggerated expressions, to draw others toward them. Their emotional landscape is typically shallow and rapidly shifting, with a tendency towards self-dramatization and theatrical expressions that lack genuine depth. Their speech patterns may appear impressionistic rather than substantive, lacking in specific details despite their animated delivery. The interpersonal relationships of those with HPD are frequently marked by challenges. They often perceive relationships as more intimate than they actually are, can be highly suggestible and easily influenced by others or current trends, and may use seduction inappropriately to establish connections. This behavior stems not from genuine romantic interest, but from the underlying need for attention and validation. The constant need for novelty, stimulation, and excitement can make maintaining long-term relationships difficult, as the initial intensity inevitably wanes. The development of HPD likely involves a complex interplay of biological predispositions and environmental factors. Some research suggests genetic components may contribute to the temperamental traits associated with HPD. Environmental influences, particularly childhood experiences involving inconsistent parental attention or validation contingent upon certain behaviors, may also play a significant role. Children who learn that dramatic or exaggerated behaviors reliably attract attention may develop these as persistent patterns into adulthood. Diagnosis of HPD requires careful clinical assessment by qualified mental health professionals. According to contemporary diagnostic frameworks, at least 5 characteristic symptoms must be present, including discomfort when not the center of attention, sexually seductive or provocative behavior, rapidly shifting and shallow emotions, consistently using physical appearance to draw attention, impressionistic speech lacking in detail, self-dramatization, theatrical expressions, and high suggestibility. These symptoms must cause significant impairment and represent a persistent pattern rather than responses to specific situations. Differential diagnosis is particularly important, as symptoms may overlap with borderline, narcissistic, or dependent personality disorders. The treatment landscape for HPD has evolved considerably in recent decades. Psychodynamic therapy approaches aim to help individuals understand unconscious motivations and developmental origins of their behaviors, potentially addressing the core insecurities driving attention-seeking patterns. Cognitive behavioral therapy focuses on identifying distorted thought patterns, such as "if I'm not noticed, I don't matter," and developing healthier coping strategies. Schema therapy has shown promise by addressing early maladaptive schemas that maintain personality disorder symptoms. While no medications specifically treat HPD, pharmacological interventions may help manage co-occurring conditions like anxiety or depression that frequently accompany the disorder. Group therapy presents unique benefits for those with HPD, providing structured opportunities to receive authentic feedback about interpersonal behaviors in a supportive environment. The group setting allows individuals to practice more balanced interaction patterns where attention is appropriately shared rather than monopolized. Dialectical behavior therapy, DBT, skills groups can be particularly helpful, teaching emotional regulation, distress tolerance, and interpersonal effectiveness, all areas of particular challenge for those with HPD. Through these approaches, individuals can gradually develop more adaptive ways of connecting with others and meeting emotional needs. The workplace implications of HPD deserve special consideration, as professional environments often trigger attention-seeking behaviors that can compromise effectiveness. Individuals may struggle with tasks requiring sustained independent focus, preferring collaborative projects where interaction is constant. They might find it difficult to accept constructive criticism, experiencing it as personal rejection rather than professional feedback. Career counseling can help identify vocations that constructively channel expressive and social tendencies. Fields like performance, sales, or certain areas of hospitality may provide appropriate outlets for their natural expressiveness while providing structure through professional boundaries. Living with or supporting someone with HPD requires particular strategies and understanding. Family members often benefit from education about the disorder to recognize that behaviors stem from psychological needs rather than intentional manipulation. Setting clear, consistent boundaries while still providing emotional validation represents a delicate but essential balance. Loved ones can encourage professional treatment while avoiding unintentionally reinforcing problematic behaviors through excessive reactions. Support groups for family members provide valuable perspective and coping strategies for the unique challenges of these relationships. The societal context and cultural factors surrounding HBD merit consideration in any comprehensive discussion. Cultural norms significantly influence what behaviors are considered appropriate expression versus excessive emotionality. What might be diagnosed as pathological in one cultural context might be within normal expectations in another. Additionally, gender biases may influence diagnosis, with similar behaviors potentially labeled differently in men versus women. Critical examination of these contextual factors helps ensure fair and accurate understanding of the condition beyond stereotypes or prejudicial assumptions about dramatic behavior. Recent research has shifted toward dimensional rather than categorical approaches to personality disorders, suggesting that HBD traits exist on continua rather than as discrete conditions. This perspective recognizes that many people may have some histrionic tendencies without meeting full diagnostic criteria for the disorder. This nuanced view promises more personalized treatment approaches tailored to each individual's specific pattern of traits and challenges. As understanding evolves, integration of neurobiological research with psychological perspectives offers hope for increasingly effective interventions for those affected by this complex condition.